After our recent discussions on a variety of different biologic drugs, many users asked us to break down the drug known as Humira, which is a monoclonal antibody with the name of Adalimumab. This is a subcutaneous injection that's given every 2 weeks to treat a variety of different conditions, such as rheumatoid arthritis, Crohn's disease, and psoriasis. And that's because it's targeting the main pathway in those conditions, which is inflammation. And in these conditions, there is an increase of a specific protein known as TNF-alpha, or tumor necrosis factor alpha, which is able to go and bind to a variety of different cells, such as immune cells, endothelial cells, fibroblasts, and bone cells. And that's because those cells have specific receptors called TNF receptor 1 and TNF receptor 2, which allows for TNF-alpha to come in and bind to them, then be internalized and elicit immune cell recruitment as well as cell death. That leads to increased amounts of inflammation in those areas, and that increase in cell death can lead to tissue damage. However, when Humira is given, this monoclonal antibody is able to bind specifically to TNF-alpha, depicted here in green. By binding directly to that protein, this prevents TNF-alpha from binding to those receptors. Therefore, it's not able to trigger those different cell types to recruit immune cells and trigger cell death. You can almost think of this drug like a capsule that goes around those proteins, preventing it from moving any further in the process. So if you have another drug that you want to learn more about, make sure to drop a comment on this video and stay connected to my channel and with Dane Garvin. Thank you all so much for watching, and if you're not already, make sure you're subscribed to the channel by clicking over here, and you may also enjoy this related video that I have over here. I'll see you on the next one.